Welcome to the SNF training part 2. I'm Teresa Mata, and I'll be presenting the coding workshop for the Social Determinants of Health and the new data elements in Section A. I hope you've all had a chance to review the recorded webinar of the same topic because that webinar provided the framework and background for this coding workshop. Also, if you haven't already done so, I suggest that you get that practice coding reference packet in front of you to help you follow along as we go through each data element and practice scenario. Okay, let's get started. So just for a quick overview for this coding workshop, we're going to focus on the new Social Determinants of Health, or SDOH, data elements, and new Section A non-SDOH data elements in the MDS 3.0 version 1.18.11. Those data elements are A1005 ethnicity, A1010 race, A1250 transportation, B1300 health literacy, B0700 social isolation, and A2121 through A2124, which represent the provision and route of reconciled medication lists to the subsequent provider and to the resident at discharge. So I'm going to begin by working through some coding scenarios based on the Social Determinants of Health, or the SDOH data elements, and then work through some of the coding scenarios for other data elements that don't fall under the designation of SDOH. So our first data element is A1005 ethnicity. And here is the snapshot of that data element. Note that this data element is collected on both admission and discharge. It's also a check all that apply item. So I'm going to review some of the coding instructions for ethnicity just to refresh your memory. If the resident provides a response, you're going to check the box or boxes that indicate the ethnic category or categories identified by the resident. If the resident is unable to respond, but the responses are determined via discussion with family, a significant other, or guardian or legally authorized representative in our medical record documentation, you're going to check all the boxes that apply, including X, resident unable to respond. If the resident is unable to respond and there are no other resources available to provide the information to inform the coding of ethnicity, you will only code X, resident unable to respond. Okay, if the resident declines to respond, you will code only Y, resident declines to respond. When the resident declines to respond, do not code based on any other resources. So you would not go to either family, significant other, guardian or legally authorized representative, or medical records to answer this data element. So here's our first coding scenario. A resident was confused and unable to answer the question related to whether they are of Hispanic, Latino, Latina, or Spanish origin. The resident's daughter stated that the resident was born in Brazil and has never considered themselves as Hispanic, Latino, Latina, or Spanish origin. So based on the scenario and the response choices available, how would you code A1005 ethnicity? We're going to give you some time to answer this on the poll that just popped up. Okay, I think we can look at this. The correct answer. Yep. Most folks got this correct. The correct answer is to check A, no, not of Hispanic, Latino, Latina, or Spanish origin, and X, resident unable to respond. Codes A and X are checked because the resident was confused and unable to answer the question. The resident's daughter was available and provided information about the resident's ethnic origin. Therefore, the assessor was able to document that the resident was not of Hispanic, Latino, Latina, or Spanish origin. As noted in the guidance manual, when a resident is unable to respond, but the responses are determined via other resources or medical record documentation, you will check all the boxes that apply, including code X. Had there not been another resource available to provide the necessary information, the resident was unable to respond, and you would check only X, resident unable to respond in that instance. So let's try one more example for the ethnicity data element. A resident was just admitted to the facility, and during their admission assessment, when asked if they were of Hispanic, Latino, Latina, or Spanish origin, they declined to respond to the question of ethnic origin. To reassure the resident, the assessor stated that they asked this question so that the treatment of the resident receives is of the highest quality of care, regardless of their ethnic background. The resident still declined to answer the question. So based on the scenario and the response choices available in the poll, how would you code A1005 ethnicity? I think we can probably close this poll. And yes, wow, just about everybody got the correct answer to this. And the correct response is Y, resident declines to respond. Code Y was chosen because the resident declined to answer the question. If a resident declines to respond, you do not use other resources such as family, significant other, guardian, legally authorized representative, or medical record documentation, even if these resources are available and would provide the necessary information to respond to the question. So the next data element that we're going to look at is A1010, race. And again, here's a snapshot of that data element. This too is a check all that apply data element and is collected on admission and discharge. So recall that in order to code A1010, you're going to check the box or boxes that indicate the race category or categories identified by the resident. If the resident is unable to respond and there is a resource available to provide this input, you would check the box or boxes that apply and code X. However, if the resident is unable to respond and there are no other resources available to provide necessary information, you would only check code X. And if the resident declines to respond, you will only check Y, resident declines to respond. When the resident declines to respond, you're not to code this data element based on any other resources. So again, you may not use family, significant other, guardian, legally authorized representative, or medical records to answer this data element if that is the case. Additionally, for this data element, code Z is also available, none of the above. And this is coded if the resident reports or it's determined from other resources that none of the listed races apply. So let's look at our first practice scenario for race. A resident was just admitted to the facility, and because they're in the late stages of dementia, their daughter is assisting with answering the assessment information. The resident's daughter stated that their father is African American. So based on that scenario and the response choices available to you, how would you code A1010 race? Okay, I think we can close the poll. Okay, we've got about 90% saying B and X. Let's look at the correct response. And that is correct. The answer is B, Black or African American, and X, resident unable to respond. Code B and code X would be checked because the resident was unable to respond accurately due to their late stage dementia, and their daughter was able to provide the information that their father is African American. Recall that the guidance states if a resident is unable to respond, but the responses are determined via family, significant other, guardian, legally authorized representative, or medical records, that you would check all boxes that apply, including code X. So we've got one more SDOH data element to review in section A, and that is A1250, transportation. And here's the snapshot of that data element. Transportation is collected on admission and discharge, but only when the assessment is coded as a 5-day PPS assessment. So when A0310B is coded 01, or on a Part A PPS discharge assessment, and that's when A0310G and A0310H are coded as 1. And so now, again, we have a reminder here of the coding instructions. You're going to code A, yes, if the resident indicates the lack of transportation has kept them from medical appointments or from getting medications. You'll code B, yes, if the resident indicates that lack of transportation has kept the resident from non-medical meetings, appointments, work, or from getting things that they need. And you'll code C, no, if the resident indicates that a lack of transportation has not kept them from medical appointments, getting medications, non-medical meetings, appointments, work, or getting things that they need. So similar to the other data elements that we have reviewed, if the resident is unable to respond and there's a resource available to provide this input, you would check the box or boxes that apply and code X, resident unable to respond. However, if the resident is unable to respond and there are no other resources available to provide the necessary information, you would only code X. If the resident declines to respond, you'll check only Y, resident declines to respond. When the resident declines to respond, remember, again, you're not to code this data element using any of the resources that might be available to you. So now that we've been refreshed on the coding instructions for transportation, let's take a look at this practice scenario. The nurse asked a resident upon admission if in the past 6 months to a year, lack of transportation kept them from medical appointments, meetings, work, or getting things needed for daily living. The resident stated that over the last 6 months, they did not have difficulty getting things needed for daily living, but they did have difficulty getting to and from their medical appointments because they were living alone and did not have a way to get to appointments. The resident reports that after discharge, they will not have difficulty getting to the doctor's appointments because their sister will be living with them. So based on the scenario and the response choices available, how would you code A1250 transportation? Again, we'll give you a little bit to answer this question. Okay, I think we can close the poll. Okay, we've got most people saying A and a few saying B and less saying C. The correct response is A. Yes, it's kept me from medical appointments or from getting my medications. Code A is checked because the resident reported that prior to admission and over the last 6 months, they had difficulty getting to medical appointments. After discharge, their sister will be moving in with them and they'll have help getting to their appointments. However, this information does not inform the coding of A1250 as the time period under consideration is 6 months to a year prior. So let's try another coding scenario for A1250. A resident was asked about whether they had any lack of transportation per the questions provided. The resident declined to answer any more questions and asked to be left alone. Even though the resident has a daughter who could respond to these questions, the resident asked that their daughter not be bothered. So based on the scenario, how would you code A1250 transportation? Okay, I think we can probably close the poll on this one. That's great. The majority of folks got the correct answer, which is Y, resident declines to respond. Code Y is checked because the resident declined to answer the question. And as we've discussed, if the resident declines to respond, you cannot code the data element based on input from any other resources, even if they are available. So now we're moving on to the SDOH data element in section B, and that's B1300, health literacy. Again, we have a snapshot of the data element, and B1300 is completed only on a 5-day PPS assessment, again, when A0310B equals 0.1, or when the assessment is a PPS discharge assessment. That is when A0310G and A0310H are both coded as 1. So let's quickly review the coding instructions for B1300. You will code 0, never, if the resident indicates never needing help reading instructions, pamphlets, or other written materials from doctors or pharmacies. You code 1, rarely, if the resident indicates that they rarely need this help. Code 2, sometimes, if the resident indicates sometimes needing help reading instructions, pamphlets, or other written materials from doctors or pharmacies. You'll code 3, often, if the resident indicates they often need this help. And you'll code 4 always if the resident indicates always needing help reading instructions, pamphlets, or other written materials from doctors or pharmacies. You'll enter code 7 if the resident declines to respond, and code 8 if the resident is unable to respond. So now let's look at the practice scenario for B1300. A resident was recently hospitalized after a heart attack with a subsequent diagnosis of atrial fibrillation and was admitted to your facility. During the 5-day PPS assessment, you ask the resident, how often do you need to have someone help you when you read instructions, pamphlets, or other written material from your doctor or pharmacy? The resident states, it was very difficult to comprehend the instructions that were given to me regarding my new warfarin medication. All the other discharge instructions I understood without a problem. I rarely had a problem with medication instructions, pamphlets, or other written materials from doctors or pharmacies, but this medication requires testing and adjustments that I just don't understand. So I need help with that. So based on this scenario and the response choices available in health literacy, how would you code B1300? Okay, let's look at the correct response. You've got it split a little bit between rarely and sometimes. The correct answer is code 1, rarely. And this was chosen because the resident reported understanding all of the discharge instructions that were given, except the instructions regarding a new medication, warfarin. The resident added that prior to the hospitalization, they rarely needed help when reading instructions, pamphlets, or other written material from doctors or pharmacies. The final SDOH data element we will review is in section D, and that's D0700, social isolation. And here is the snapshot of that data element, which is collected on admission and discharge. Again, we'll refresh our memories by reviewing the coding instructions for D0700 before we go to the practice scenarios. You'll code 0 never if the resident indicates never feeling lonely or isolated from others. You'll code 1 if the resident rarely feels this way. Code 2 sometimes if the resident indicates sometimes feeling lonely or isolated from others. You'll code 3 often if the resident often feels this way. And you'll choose code 4 always if the resident indicates they always feel lonely or isolated from others. And again, you would choose code 7 if the resident declines to respond, or code 8 if the resident is unable to respond. So let's try this practice scenario for D0700. A resident with early stage dementia who's been in the facility for a year was asked during the observation period of the annual assessment about how often they have felt lonely or isolated from those around them. The resident stated that they did not want to answer any more questions. The resident's spouse, who happened to be in the room, offered that they have noticed that the resident rarely seems lonely since they have started to participate in more activities and have some new friends. Based on the scenario we just reviewed and the response choices available, how would you code D0700 social isolation? Okay, let's move on to the answer. And a good majority of folks got the correct response, which is 7. Resident declines to respond. And this was chosen because the resident declined to respond to the question about how lonely or isolated they feel from those around them. Even though the resident's spouse did offer that the resident rarely seems lonely now, this data element is intended to be self-report, so no other source should be used to identify the response. So now let's move on to a few data elements that are standardized data elements, but are not looked at under the lens of social determinants of health. The first 2 data elements we're going to review are A2121, which is the provision of current reconciled medication list to subsequent provider at discharge, and A2122, which is the route of current reconciled medication list transmission to the subsequent provider. So first we'll look at A2121, which is collected only on a Part A PPS discharge. And if the information collected in that discharge status data element A2105 on discharge is coded as 02 through 12. This is collected as close to the time of discharge as possible. So let's review the coding instructions. You're going to code no if it discharged to a subsequent provider. The facility did not provide the resident's current reconciled medication list to the subsequent provider, or the resident was not discharged to a subsequent provider. And you'll code yes if at discharge to a subsequent provider, the facility did provide the resident's current reconciled medication list to that subsequent provider. And as was stated in the coding instructions, you would need to know the discharge location to which the resident is being discharged in order to code this data element accurately. This information can be found in A2105, discharge status, and will identify the subsequent providers which pertain to coding this data element. Again, for coding, you'd only need to see if A2105 was coded with any of the response choices from 0, 2 through 12, which you can see on this slide. Please note that this data element was revised and aligned across most PAC assessment instruments and was discussed in the understanding changes to the REI presentation. So if you've not yet reviewed that presentation, this is where to go to see the changes that were made in this data element. So here's a snapshot for A2122, route of current reconciled medication list, transmission to subsequent provider. This is completed only if the response to A2121 is coded 1, yes. To prepare for this coding this data element, it's important to try to establish with each subsequent provider how they're able to receive information from your facility. The routes may not always be documented in the resident records, so it's helpful to understand and document how your facility typically transmits information to each subsequent provider at discharge. Also, since this is a check all that apply data element, you can check more than one route of transmission. And here are the coding instructions. You will check A2122A, electronic health record, if the facility has an electronic health record or electronic medical record, and use it to transmit or provide access to the reconciled medication list to the subsequent provider. This includes situations where there's a shared EHR that both the facility and subsequent provider can access. Of note, checking this route doesn't require that there's confirmation from the subsequent provider that they accessed the common EHR to obtain the medication list. A2122B, health information exchange, would be checked if your facility participates in a health information exchange or HIE, and use the HIE to electronically exchange the current reconciled medication list with the subsequent provider. You will check A2122C, verbal, if the current reconciled medication list information was verbally communicated. So that would be either in person or on the telephone or via video conferencing to the subsequent provider. You'll check A2122D, paper-based, if the current reconciled medication list was transmitted to the subsequent provider using a paper-based method, such as a printout, fax, or eFax. And finally, you would check A2122E, other methods, if the current reconciled medication list was transmitted to the subsequent provider using another method not listed above, such as texting, email, or on a CD. And so here's our practice scenario for both A2121 and A2122. So a resident's being sent to an acute care hospital in a healthcare system that uses the same EHR as your facility. This means that the acute care hospital staff admitting the resident will be able to access this information as soon as it's transmitted. The resident's reconciled medication list, their progress notes, and transfer information are uploaded into the EHR by your facility at the time of discharge. While the discharge nurse received a system message of a successful transmission upon sending the information, there's been no confirmation that the acute care hospital staff have accessed this information. So first, how would you code A2121 based on the scenario? Okay, I think we can close the poll on this one. And let's check the correct response. And the correct response is 1, yes. Current medication list was provided to the subsequent provider. And code 1 was chosen because the nurse uploaded the resident's reconciled medication list and other documentation to the shared EHR of the receiving acute care hospital. An acute care hospital corresponds to code 04 in A2105. So it is within the appropriate range of responses in 02 and 12 required by this data element. Again, note the confirmation that the subsequent provider has accessed the common EHR system to obtain the reconciled medication list isn't required in order to code 1 is yes. So now let's look at A2122. How would you code this data element based on the scenario? So you're thinking about how that medication list was transmitted. Okay, let's move on to the correct answer. And 91% of you got that correct. The correct response is A, electronic health record. And this was checked because the acute care hospital and the facility share the same EHR system, and each provider can access the information directly, and that is how this information was transmitted. As an aside, this would be similar to a health information exchange or HIE if both the receiving entity and the facility had access to the resident's information through that exchange. And here are our last two non-SDOH data elements in section A. The first is A2123, provision of current reconciled medication list to the resident at discharge, and A2124, route of current reconciled medication list transmission to the resident. So this data element is only completed on discharge as close to the time of discharge as possible, when the discharge assessment is coded as A0310H equals 1, which is a party PPS discharge. And if the discharge status is coded as 01, which is home or community, or coded 99 not listed, which is if the resident was discharged, none of the listed locations. So for the discharge to home community, home means that on discharge, the resident went to a private home, apartment, boarding care, assisted living facility, group home, transitional living, or adult foster care. A community residential setting is defined as any house, condominium, or apartment in the community, whether owned by the resident or another person, retirement community, or independent housing for the elderly. So let's look at the coding instructions for A2123. You'll choose code 0, no, if the resident was discharged to a home setting. So again, A2105 equals 01, or a not listed location, A2105 equals 99. And the facility did not provide the resident's current reconciled medication list to the resident, family, guardian, legally authorized representative, and or caregiver. Or you'll code 1 yes if it discharged to a home setting or not listed location. The facility did provide the resident's current reconciled medication list to the resident, family, guardian, legally authorized representative, and or caregiver. Remember, the recipient of the current reconciled medication list can be the resident, family member, significant other, guardian, legally authorized representative, and or caregiver in order to code 1 yes. You should also ensure that you're choosing the most appropriate way to provide this information to the resident and or their family, significant other, guardian, legally authorized representative, and or caregiver. It's not necessary to provide the current reconciled medication list to all of these recipients in order to code 1 yes. And here we have a snapshot of A2124. And note, again, this is only completed if the transmission, or in this case, A2123, is coded 1 yes. And here are the coding instructions for A2124. You're going to select the codes that correspond to the routes of transmission or routes of transmission used to provide the medication list to the family member, significant other, guardian, legally authorized representative, and or caregiver. And note that the response choices for the route of transmission in this data element are the same as those listed in A2122. So here's our practice scenario for A2123 and A2124. A resident had several medications discontinued during their PPS stay at the facility. At the time of discharge home, the resident still had an over-the-counter heartburn relief medication, as well as numerous prescription medications. The nurse verbally reviewed all medications, and the resident confirmed understanding of each medication, how to take them, what doses you take, and when. The nurse handed a printed copy of the current reconciled medication list to the resident at the time of discharge. The resident also asked for a copy to give to their daughter. So based on the scenario, how would you code A2123, which is the provision of the current reconciled medication list to the resident at discharge? can complete this poll. And the majority of folks got this correct. The correct answer is 1. Yes, the current reconciled medication list was provided to the resident at discharge. The data element was coded as yes because the resident was discharged home. So A2105 would likely have been coded 01 home community setting. And the resident was provided with the reconciled medication list. The resident asked that their daughter also receive the reconciled medication list, but remember that it's not necessary to provide the current reconciled medication list to all of the recipients listed in order to code 1 yes. So now let's look at A2124. How would you code the root of the current reconciled medication list transmission to the resident? So now again, we're looking at how that was transmitted. And remember again, this is check all that apply. Okay, let's look at the answer. And the majority of folks got this correct. The correct answer is C, verbal, and D, paper-based. So verbal and paper-based were checked because the nurse verbally reviewed the reconciled medication list with the resident and also provided a paper copy of the reconciled medication list at discharge. So this brings us to the end of the coding workshop for the SDOH data elements and the new data elements in section A. But I'd like to review some key insights related to the data elements we reviewed as part of this workshop. SDOH can affect a wide range of health risks and outcomes and are important factors to consider when collecting resident data. Collection of these data is an important step in improving quality of care and health outcomes. Access to transportation is essential to effective care management and can facilitate the resident's connection within the community. Poor health literacy interferes with communication between provider and resident and is linked to poor outcomes, higher medical costs, decrease in preventive service visits, and increase in emergency department use. Social isolation increases with age. It's a risk factor for physical and mental illness and is a predictor of mortality. And ensuring that a current reconciled medication list is provided to a subsequent provider and or a resident at time of discharge is critical to ensure safe and effective transitions of care. So thank you for your time and attention.
Thank you, Teresa. Hello, everyone. My name is Lisa Newton. I'm a registered nurse and a senior staff associate at Econometrica in Bethesda, Maryland, and I will be moderating the Q&A sessions today. Just a note, I know several of you are raising your hands, so we are addressing questions and comments in the chat in the Q&A. So please take a look at that because hopefully your question will be answered there. So Teresa, our first question for you is, for data elements A1005 ethnicity and A1010 race, our admission department collects this data as part of our pre-admission process from the hospital. Can we use that information to code these data elements, or do they need to be assessed after the resident is admitted?
Yeah, thanks for that question. So both of these data elements are self-reported data elements, and the questions for each should be asked of the resident after they're admitted to the facility, so and during that appropriate assessment period. Facility medical record documentation can be used as the data source for these data elements, but only if the resident is unable to respond and no family member, significant other, or guardian or legally authorized representative can provide a response.
Okay, thank you. Our next question. If a resident is discharged to home with home health services and a reconciled medication list is only given to the resident at discharge, would this be considered as provided to the subsequent provider for A2121 provision of reconciled medication list to subsequent provider at discharge?
Okay, no. A2121, the provision of current reconciled medication list to the subsequent provider at discharge, would identify at the time of discharge the facility provided the resident's current reconciled medication list to the subsequent provider, as listed in the 0 to the 12 in A2105 discharge status. So in this scenario, if the facility didn't provide a reconciled medication list to the home health agency, A2121 would be coded as 0 no. And again, the rationale for this is that the resident was discharged to a subsequent provider that was identified in A2105, the discharge status, and that would be number 12, home under care of an organized home health service organization. And the SNF did not provide the reconciled medications to the subsequent provider if they did not give it to the home health agency.
Okay, thank you. Our next question, for D0700 social isolation, will there be additional guidance to help clinicians determine the difference between response options sometimes and often? Will the definitions for sometimes and often be provided?
So for this data element, again, this is another self-report data element. And really the interpretation of the response choices is up to the resident to determine for themselves. So the assessor should just offer the response choices as they're written and ask the resident to choose one of the responses that most closely will align with their experience about how often they feel lonely or isolated from those around them. Thanks for that question.